Welcome along. Today we are talking to Dr. Nicola Barclay. So, Nicola, if you would like to introduce yourself, tell us what you do.
Yeah, sure. Thank you for having me, Emily. So, I'm a departmental lecturer in sleep medicine at the University of Oxford. I work in the Nuffield Department of Clinical Neurosciences, and I teach on a master's programme in sleep medicine, training doctors, GPs, psychiatrists, psychologists in all things sleep, from the neurobiology, neurophysiology, right through to the methods that we use in sleep research and clinical sleep medicine to evaluate sleep and circadian rhythms, right through to diagnosing and managing all of the hundreds of weird and wacky sleep disorders that we see across the lifespan, right from pediatric sleep medicine through middle age and right up into older adulthood. So the whole spectrum of sleep disturbances that we can see in primary sleep disorders, but also when they're comorbid with other difficulties as well. So that's what I do in terms of teaching. My research interests lie in understanding the genetic and environmental factors contributing to insomnia and also circadian abnormalities, and looking at the role of what we call clock genes in the regulation of circadian patterning of sleep wake rhythms, and managing that, and how we can use what we know about our genetic underpinnings to develop novel therapies.
Wow. Okay.
In a
And I know
nutshell.
that you have very recently researched an article about sleep and the menopause and perimenopause. So this is very, very good timing.
It's really good timing. So I think there's always a lot of interest in sleep, but now we're seeing how sleep changes across particular life periods. And we know that sleep changes drastically across the lifespan at particular developmental time points. So we know a lot about the changes in sleep that happen in puberty, but we also know now that there are changes in sleep that occur during the menopause and also in earlier times before the menopause in the perimenopause as well, and then beyond. So yeah, we can talk about that.
So all the ladies watching this who are either sleeping or would happily sleep 24 hours a day, and on the other side, the ladies who are struggling to get even 3 hours sleep, actually it's normal what they're going through, is it?
It's normal to have that much variability anyway in any stage of life. We never should be expecting to get this golden 8 hours of sleep. Yes, for some people they do need 8 hours. Some people need more than 8 hours. Some people need less than 8 hours. There's a normal distribution in sleep duration. And so we shouldn't all be trying to this one size fits all, this one sleep duration is right for all, because it's not the case. There's individual variability. And that's partly dictated by genes. So different genetic predispositions can mean that somebody's a particularly short sleeper or a particularly long sleeper. Now, there has been a lot of press recently about the catastrophic effects of short sleep and long sleep. And yes, if it's not your biological tendency to have short or long sleep, then it's going to be problematic. But for some
Yeah.
people that are fine with that short and long sleep, it's fine.
Well, that, I
um,
mean, I remember it being the sort of headline thing that Maggie Thatcher used to survive on 4 hours sleep, and obviously for her that was fine, wasn't it? I would be worse than useless on that little.
and it's
I'd be a
quite
danger zone.
Yeah, there's been studies that have looked at personality characteristics correlating with different sleep durations, and we see that people who are particularly entrepreneurial are short sleepers. So short sleep is associated with creativity, with extravagant personality types and extroversion. So we do see certain personality characteristics going hand in hand with sleep duration. And so in those individuals, they may well be fine on short sleep. But for the majority of us, if we need more and we get less, it's not optimum at all. And it is, yeah, it's bad for almost every health outcome. So fitting in with our biological need is what we need to do.
Okay, so bearing in mind that a lot of women in this phase really struggle with fatigue, so our topic this month is fatigue, which obviously, funnily enough, ties in with sleep. Um, are there things people can do to sort of curb the insomnia, or people who are finding they suddenly need? This is two questions clearly, but I'm bunging them all in one. So on the insomnia side, are there things people can do to help themselves? And on the other side, the people who are finding that they are just fatigued all the time, regardless of how much sleep, are there things that they can do?
Yeah, so the way I'm going to tackle these questions is differentiating these terms first. So fatigue isn't always the same as tiredness and sleepiness, okay?
Yeah.
So when I talk about insomnia, I usually don't see fatigue as a feature of insomnia. So fatigue isn't one of the defining criteria of insomnia. We would say tiredness, daytime sleepiness.
Okay.
So you're about to fall asleep. Fatigue is this lack of energy, lack of motivational drive, feeling tired, but not necessarily about to drop off to sleep. And you can feel fatigued after having a really long period of sleep and still feel lethargic and without any energy, but not necessarily feeling sleepy as such. Okay.
Mm-hmm.
So when I'm talking about insomnia, I'm going to see how that then can impact on daytime sleepiness. So what can we do to help people get to sleep? And we know that females are more likely to experience insomnia at any stage of life, which suggests one thing: it suggests hormones. That's the differentiating thing between males and females. We're seeing that it's hormone related. So it's no surprise then that we're going to see more increased prevalence of insomnia during the peri and menopausal phase, which we do. So what then is contributing to that? So some of the symptoms that can contribute to insomnia during the perimenopause can be the occurrence of hot flashes and generally just feeling hot. So it's thought that maybe that does contribute to difficulties getting to sleep. So our brain and body ideally want to be cool at sleep onset. It facilitates sleep onset being cool. If our brain and body are at a high body temperature, we're not going to get to sleep. So we need to keep ourselves cool. An ideal ambient temperature is between 16 and 18 degrees Celsius in our environment. So you might think that's pretty chilly, but we do want to get our core body temperature and our brain temperature down in order to facilitate sleep onset. So we can imagine then that if we're experiencing hot flashes, that's going to interfere with that. And yes, it does. So trying to manage our external environment to facilitate cooling as much as possible. So keeping windows open, not having big heavy sheets, get rid of your pajamas, anything that you can to cool yourself down. And so some people will say, have a hot bath. So you might think that that's counterintuitive, but actually if we have a hot bath before going to bed, when we get out of the bath, hitting the cool air facilitates that heat loss. So actually that initiates the natural brain and body cooling. So having a hot bath actually can help. And also quite counterintuitively, if we warm our extremities, that also facilitates heat loss. So if we put socks on, then it's going to transfer our core body temperature from our core to our periphery, allow our blood vessels to dilate, and heat can then be transferred into the external environment. So actually keeping our feet warm can actually make our core body temperature cooler.
Isn't that interesting? Because you would think you kind of automatically would stick your foot out of the duvet, wouldn't you, to try and cool down?
It's kind of counterintuitive.
Yeah.
But obviously on super hot nights in the summer, and heat, we've got a heat wave coming now.
Yeah.
I'm wearing socks because that's probably not going to help it in really hot environments. So keeping yourself cool is one thing. Another reason why we might experience more difficulties with sleep during the perimenopause is because the change in the hormones. So we see a drop in the production of estrogen and progesterone during the perimenopause. And these two hormones are also linked with good sleep, and they facilitate the production of serotonin and melatonin in the body. And these are important, some of the neurochemicals that are involved in sleep, in the sleep-wake cycle. So when we see estrogen levels beginning to drop, we may notice that people wake up more during the night, may take longer to fall asleep. So we're seeing these symptoms of insomnia. But also the change in production of melatonin. So melatonin is sometimes called the hormone of darkness. It's this hormone that's released during the evening hours, which chemically makes us feel sleepy. Levels rise during the evening until we're asleep, and they drop off as the night goes on and are almost absent, if not absent, during the waking day. So if The reduction of estrogen is reducing the ability of the brain to produce melatonin, then it's going to make it difficult for us to fall asleep at night time. So that could also contribute to difficulties getting to sleep. But that whole change in the melatonin rhythm could also lead to early morning awakenings. So the melatonin rhythm may tail off a little bit earlier. I mean that women are waking up earlier. And I've seen this frequently with women getting really frustrated that they're waking up early, say 5 o'clock in the morning, and they're not able to get back to sleep again. But actually that's normal as well. And we see that normal across the lifespan. So we know that there are huge changes in circadian rhythms across the lifespan. So when we're children, we're very morning oriented. My daughter's very morning oriented, gets up at stupid o'clock. She's happy to be up at 5:30. But then as children get a little bit older, during the teenage years, they're extreme evening types. They reach an eveningness peak at the age of 22, staying out late, partying until 2 in the morning, finding it difficult to get up before midday. And that's a biological change that's associated with puberty. From the age 22 onwards, we see this change again back to morning type. And that's in men as well. It's not just in females, it's in males as well. And then by the time we're older adults, we have very, very early chronotypes, early morning types. And that's because of the change in the rhythmicity of melatonin. And even in older adults, some older adults produce negligible amounts of melatonin. So actually the chemical signal for sleepiness is almost absent in some individuals, especially where there's neurodegeneration as well. But that's not the period of life that we're talking about. But my point really is that melatonin can have a huge influence on the circadian rhythmicity of the sleep-wake schedule in the perimenopause, contributing to difficulties getting to sleep, but also then early morning awakening.
Can I just quickly ask something? Sorry, Nicola, can I ask something?
Yeah.
So you said about the progesterone impact on sleep. Would that explain, even just during the premenopause phase, just so during the regular period cycle time of a woman's life, would that explain why often women feel particularly lethargic in the run-up to their period and don't sleep as well? So it's all that, but when we get into perimenopause, it's just exacerbated and heightened.
Yeah,
okay.
And that can, absolutely, because we do see monthly cycles, monthly changes in our sleep in 20s, 30s, 40s, absolutely.
And it just comes to a head at the perimenopause. Okay.
And because we change temperature during our period, and that is also going to contribute to difficulty to sleep. But it could also be the hormonal change altering all of the sleep-wake hormones as well. So other things that we can do then, so whilst all of these neurochemical changes are taking place that we can't control, what can we do then to make our sleep as best as it can be? And one of the easy fixes is caffeine. And I know that a lot of people will be reliant on caffeine to help them feel awake, but in my opinion, it's exacerbating a problem, because the half-life of caffeine is really long. So I think the half-life of it is around 5 hours. My example of this is if we were to have a double espresso at 4 p.m, we still have an espresso in our system at 9 p.m. And would you want to have an espresso before you go to bed? Probably not. But there's differences in individuals' sensitivity to caffeine. So some people can consume caffeine right up until bedtime and not have any effect on their sleep. Whereas other people who are highly sensitive, I myself am very sensitive to caffeine, if I have a cup of tea after midday, I will find it difficult to get to sleep. So everybody will have an idea of their sensitivity. If you think you're a sensitive person, don't have any caffeine after midday. And I'm very strict about that with my own sleep. And like I say, on the days when I do give in, have a cup of tea, it really does ruin my sleep. And so if you enjoy a cup of coffee after your evening meal, have decaf or have a herbal tea. That's an easy one to fix. Alcohol, another easy one to fix. In small amounts, alcohol, the old nightcap before bed, can facilitate sleep onset, but it ruins the sleep in the second half of your night. In the second half of your night, you're more likely to experience REM sleep. This is rapid eye movement sleep, which is associated with emotional regulation. But we find if we have too much alcohol, even more than one drink, that can disrupt REM sleep, which can make us not able to regulate our emotions. The following day, we may be experiencing more mood disturbances, feeling miserable, but also we've had fragmented sleep as well. So we've not only got mood changes as a result of not getting all that REM sleep that we need, we've kind of curtailed our sleep duration as well. So we're going to feel sleepy and groggy for that reason. Mm-hmm. So whilst we might think, oh, if I have a glass of wine, it might help, it's actually going to worsen your next day. Even if you don't have a hangover, it's going to worsen your next day. So maybe sticking to one drink or none at all. If you're in a period where you're feeling, you really want to tackle your sleep, then alcohol's a no-go. Foods, not eating heavy meals before bedtime. We don't want you to be, digesting food just before you go to bed. It's also going to increase your core body temperature. And as we've talked about core body temperature, we want to be cool when we're going to sleep. So not having a heavy meal. Keeping the sleep environment cool, we've mentioned that. Also avoiding screen time before bed. So I don't think we've mentioned much about light. Light inhibits melatonin. Remember, we talked about melatonin, our hormone of darkness, which chemically makes us sleepy. So short wavelengths of light, which is typically blue light, so light in the blue spectrum, delays melatonin onset. So we're going to delay that sleepiness signal. So if we're in the evening watching an iPad or on our phone really close to our eyes, we are inhibiting our melatonin. We're making ourselves physiologically stay awake longer and longer, which is then going to exacerbate any circadian problems that we may be initiating. So reducing screen time. And some people say reduce screen time the hour before bed. But melatonin usually onsets between 2 to 4 hours before our habitual sleep period. So actually, I would say no screen time 2 to 4 hours before bed. Watching TV, having something in the distance is fine. So it's when we have these things that are close up, or put them on night mode, or use a filter, a screen filter, to stop those short blue wavelengths of light.
Because a lot of phones now have a night setting, don't they?
Yeah, so switching on the night mode. Mm-hmm. There has been some, I wouldn't say research, there has been some, how can I phrase this? You have to edit that bit out. The script is coming out, this is the problem. Always maintain a healthy, balanced diet, obviously eating lots of fruit and vegetables. There have been some studies that have aimed to look to see whether certain fruits and vegetables may be good for initiating melatonin or increasing melatonin. So we know that there are some melatonin-rich foods, such as tart cherries. There has been some evidence to say that tart cherries or almonds may be good for melatonin. But I take that evidence with a pinch of salt. The amount of these cherries that you would have to consume in order for it to have an effect is probably pretty huge. So my suggestion there is simply being healthy.
And so if we've got women going through this phase who are really struggling with their energy levels, they have cleaned up their evening routine, so they're being really strict about caffeine, they're being strict about alcohol, they're keeping away from the screen time. Do you find that people adding some exercise into the day helps with sleep?
Yes, absolutely.
Presumably earlier in the day so that they're not too hot when they get back, or is that?
Yes, well, to some extent it is personal. So the correct time for us to do exercise in terms of our sleep depends on, again, our chronotype. So whether we're morning people or evening people, or somewhere in between. So, but generally speaking, for the majority of the population who sort of fall in the middle of this morningness and eveningness, who are more neither type individuals, would go to bed, say 10, 10:30, waking up around 6 or 7. That's kind of a neither type category, not at the extremes. Usually in the early afternoon, up to around about 4 p.m, 5 p.m, I would recommend exercise. And exercise stimulates slow wave sleep. So once we've had a day where we've done some exercise, we're more likely to see slow wave sleep, rich sleep. If we were to hook somebody up to polysomnography, which is where we measure the electrical activity of our brain during sleep, so we can look at the different sleep stages, we see more of these slow waves after exercise. And these slow waves are really good for brain and body restoration. And this is what we call our deep sleep. And we usually get that deep sleep in the first third of our night. So intense exercise boosts those slow waves, which will help us to feel refreshed the next day.
And does it need to be intense exercise, or can it be just walking and yoga and things, or does it want to be pretty full on?
Again, that depends on the individual. I think if you're completely exercise naive, then starting with something less intense and building up the intensity as you get more used to undergoing exercise.
Yeah.
For some people, that may be going for a brisk walk, or as you say, doing yoga, but actually yoga is really intense.
Yeah.
So it's really getting your heart rate above your resting heart rate.
Wow. And I'm going to ask one last question, which is, I think it's the cruel fate of nature that a lot of women hit perimenopause just as their teenagers, their children are hitting teenage.
Yeah.
So that's two completely different sleep styles wanting to battle for supremacy in a house. Yes. Do you have any advice for women going through that on how they manage it? Is it a question of just live and let live, or is it a question of each to their own?
We need to understand that the changes in sleep and circadian rhythms that teenagers go through is immense. And they're not just being lazy. There is a physiological need for them to be sleeping at the time that they're sleeping. And there's been a lot of attempts to change school start times, both here in the UK and in the US. They've had some success in the US, but mind you, their school start times are very early. They usually start school at 7 a.m. And so they've managed to now, in some states, shift those to 8:30 a.m., which for them is great, but for us, that's still earlier than our usual high school start school. But there is that acknowledgement now that actually our teenagers do need to sleep at that time of day, and that it's normal, and we shouldn't necessarily be pressuring them to get up early. Obviously, we have to, because they have to go to school and college. But so there is that social demand there, which kind of gets in the way of their biological need, but understanding that it is a biological need and they're not being lazy. So where we can, weekends, we can let them sleep when they need to sleep.
And we as women going through the perimenopause also need to grab that extra sleep sometimes as well. And I guess as much as anything, it's a question of all being kind to ourselves rather than just trying to fit in with what society tells us we should be doing.
Yes, exactly. Society and the 9 till 5 really get in the way of our individual biological needs. One last thing that I will mention is napping. Napping really interferes with our nighttime sleep. So if we're having problems with getting off to sleep, I wouldn't necessarily recommend an afternoon, evening nap. If you really need to, morning naps can be less disruptive to the nighttime sleep period. So if you are particularly sleepy, then try and have a nap in the morning rather than in the afternoon or evening. You don't want to ruin your cycle, your sleep cycle. Trying to stay consistent with your bedtimes across the working week and at weekends. So trying to avoid that tendency to oversleep at weekends to make up for the lost sleep, again, because it's disrupting that rhythmicity. And being very strict with yourself during the working week and going to bed at a set time that works for you. So I always go to bed at 10:30. If I miss that 10:30 window, I find it very difficult to get to sleep, even if it's later and later. So knowing when your time is and sticking with it.
Wow, that's a lot of really useful information. Thank you, Nicola.
Good, you're welcome.
Excellent. So when I pop this video everywhere, would you be okay to answer a few questions if anybody has some questions coming off the back of this?
Yeah, that's absolutely fine. Yes. You've got my email.
Yeah, I'll ask people to put questions in the Facebook group and things, and that's just easiest. Yeah. Perfect. Thank you very, very much.
You're very welcome. Thank you for having me.